we know that when hospitals administer drugs to patients like chemotherapies, they basically set the price, negotiate the price with insurers. So they buy the drug for one price, and then they have a reimbursement rate that they get with insurers. We were trying to figure out what those prices look like in the marketplace, because we were getting reports from big plans, union plans that cover lots of patients, that they were seeing some prices that looked irrational, some prices where they were paying thousands of dollars for drugs where Medicare would pay a tiny fraction of that. So we were really trying to get some data and reporting to understand what was going on in this market.
And one of your takeaways is that hospital systems often charge insurers up to 5 times what Medicare has to pay for those same drugs. And if you had to boil it down to why that is, what's the reason behind it?
Yeah, I mean, the hospitals are trying to turn a profit on their commercial plans because they say they lose money often paying, providing care to people on Medicare or Medicaid. What's interesting is that there's a huge variation in the prices we're finding. And, many hospitals in our data set were just charging like 1 or 2 or 3 times the Medicare price. Then we found examples of some hospitals charging hundreds of times the Medicare price.
All right, I'm as guilty as anybody. When I get the bill from the doctor or from whatever, I don't know what it is.
Because you have good insurance, Paul.
I do have good insurance. I have the best insurance. But it just, when the numbers on the bill itself, no idea. So,
and sometimes the numbers are bananas, too.
I just look down at the bottom and say, thank you, insurance. But for a lot of people, they don't have that luxury. Tell us about Ida Martin.
Yeah, so Ida Martin was a patient treated for colon cancer in Chicago. She was on a union health insurance plan. Her first chemotherapy treatment for a drug called oxaliplatin, it's a more than 20-year-old cancer medication, generic, relatively inexpensive on the market. Her first infusion was billed at more than $13,000. That's the amount that the insurance plan, her union health fund, paid for her care.
To the hospital.
To the hospital. She went down the street to a clinic still within the same health system for her next infusion, and it was $134.
Jeez.
So we're just seeing the kind of huge differences in price.
And do we know what, like, a dumb way to phrase it, what's the list price of this thing? What is it?
That is a complicated question.
I know.
But the Medicare, one way to think about it is for her dose for this drug, the Medicare rate, which is based on a benchmark Medicare determines to be the average sales price of this drug. So the average that hospitals can acquire this drug for, they use that number plus 6%, and they would have paid $35 for this dose.
So you spent a lot of your reporting really digging into trying to figure out the pricing, like you said, and that's a Herculean effort because everything about this healthcare system is about, not being transparent, about, having your leverage points and getting what you need. But I remember that under the first Trump administration, they were pushing for more transparency. They wanted hospitals, they wanted insurance companies to reveal their prices. Did that get anywhere?
Yes, it did. And there is actually a lot more price transparency now than there was before that policy, which started under Trump. It was continued under the Biden administration. It is sort of, I would say, fits and starts. It is imperfect. A lot of the data is difficult to interpret, but and incomplete. But it is much better than where we were a decade ago. And some of the reporting and analysis we brought to this piece wouldn't have been possible without some of those regulations.